having worked at 3 universities and can bike to all of them and hasn't moved where he lives. So he's worked at Harvard, Northeastern, and is now just started a position at Boston University where he's the Dean of Sargent College. Jack has been a long-time ergonomics researcher, did his PhD with David Rempel, if you know David Rempel at Berkeley. And he's been one of the heads of one of the NIOSH research centers in the US for many years. More than one. There you go. So he's going to talk to us today about enterprise solutions and total worker health. So trying to bring this whole bridge together of what's happening in companies and where it meets workers. So I'll turn it over to you, Jack.
Yeah, thank you, Jack. And yeah, I've had the privilege of biking to work for a long time, and one of the things that Jack and I both enjoy is bicycling. And I encourage you to actually look my name up with bike safety on PubMed and see what you find. It's actually one study I did is way old now, but I actually studied bicycle messengers 22 years ago, and I had just learned the term ethnography. And so I spent a day riding with a bike messenger in Boston, and it totally changed how I commute. I learned to take a lane and all sorts of different things because the infrastructure in Boston wasn't that great 20 years ago. We've improved greatly over the last 20 years, and looking at how the design of the city and really looking at the built environment can really change the experience of a bicyclist, and really thinking about how does that design impact their health and safety. And that's what we do as ergonomists all the time. Anyway, I've been on the new job for about, I started August 1st, so this is day 62 or something like that. I also started the same day as our new president at Boston University. He's an interim president, and he's been doing the circuit of, we've had orientation and alumni weekends and all these things over the last month. And he's also been saying, yeah, day 62 or whatever, yeah, day 61, I think, because 30 plus, well, anyway, my math, I need the calculator. But I realized quickly he was counting the weekends. So when Jack invited me up for this weekend, I was like, you know, this is going to be a perfect timing. It's after September, which is, as a new dean, is one of the hardest months of my life, I think, that I'm just coming out of. So to come here and be able to talk about science and what I love, and that is how design impacts health, is really exciting. So I want to thank Jack for having me here, and it's a great honor. A little bit about my history, because my history started off as I'm an engineer by training. I started looking at like keyboards and how people type, and then I looked up and said, oh, there's a whole computer and there's a mouse too, and started looking at it. And then I realized, wait, it's part of a workstation. The whole workstation is here, and so I started looking at workstations. And then I looked up and said, oh, there's a whole workplace around here. and then started looking at that, and that was really kind of, and then wait, this workplace is part of this, economy and this whole social context. And that's really what I'm presenting today, is that whole realization of going from, from the little micro stuff that I studied, looking at the biomechanics of fingers and typing. Pete Kier, who's here, was in our lab at Cal Berkeley, and realizing, yeah, I was studying touch typing. I got up to 60 words per minute, and then realized that there was, over time, that while design and making the physical part of the job important, it's only a sufficient condition. It's a necessary but not sufficient condition. And you actually have to think about design, but organizational, and also the social context, and all of those things to have a successful ergonomics program, and to be able to have an impact on the worker safety and health. So I can look at all the designs I want, but if we don't have a system in place that incorporates that design into a bigger, more global approach to worker safety and health, our impact is going to be less. We saw that in the calculator with just behavioral-based programs versus looking at eliminating the hazards. So that's the message I have for you today, is really thinking about the systems framework. I like to use the word systems because as an engineer, my favorite class at undergraduate was systems theory and system dynamics. So I love drawing pictures. I'm going to share with you a contextual model that we've developed at the Center for Work Health and Wellbeing. I'm going to go through some basic, this is the outline of my talk. I'm going to talk about definitions. As an engineer, I believe in first principles. And so going to the definition is always how I go. I mean, even now as dean, I'm going to our bylaws to say, what did the bylaws say? But as an engineer, it's like, what are the first principles? So I'm going to spend time talking about the definitions, some of which we've already been talking about. Then I'm going to go in and talk about the systems framework that we developed at the center to look at total worker health and looking at how organizational factors impact the conditions of work that not only impact worker safety and health, but also impact enterprise outcomes and the like. I'm going to give you some examples of interventions we've actually run and that some of the feedback we've gotten from the companies that go beyond just worker safety and health. And then just give you some corporate level evidence too, because what's hard in some of the stuff that we're talking about is when we say evidence-based, we often think about randomized controlled trials and the like, but those are really hard to do when you're talking about organizational interventions because there's so many different factors. I've run RCTs on construction sites and it's hard. It's very hard. And I was successful in a couple, but then you start looking at the different ways construction is set up and all your assumptions about how you can do it fall apart. And it's really difficult. So when we say what is the evidence for doing this, we have to often then go to the case studies and look at different methods for that. And so that's how I'll wrap up. Okay, so I remember David Rempel, when I was in his lab, forced me to take ergonomics. I was like, I'm an engineer, I want to study biomechanics. He goes, you need to take this course. I got a B. Maybe that's why I'm not a CPE jack. When I got hired by Harvard as an assistant professor, it was in ergonomics. Stover Snook had retired and was taking over his classes. IEA had just come out with their definition, and I really love this definition. And it's long because it was incorporated a lot of different stakeholders, but it has key aspects to it, and it really talks about this fact. And this is what makes sort of ergonomics and musculoskeletal disorders a little bit more difficult than sort of chemical and industrial, the industrial hygiene approach of the hierarchy of controls, is that we're talking about human systems. And that human systems are part of the equation that we have here. And so ergonomics really, it talks about a scientific discipline, not an adjective for a chair or a design, but actually a discipline with the interactions among humans and other elements of the system. So it's understanding that, it's getting back to that bike or transportation model, we know that it's, that humans have a certain behavior and we have to design systems around that sense of behavior and understand how do we create an environment that makes that behavior not catastrophic when humans do make errors. I always like to refer to a case that Stover Snook always talked about in his, where in the 1970s somebody was looking at people dropping this expensive equipment. Probably was just a calculator. But anyway, they would drop this equipment all the time. But the case study actually looked at the processes of the manufacturing, realizing that, people do drop things. And in fact, people drop things pretty regularly. And these workers were actually pretty good at not dropping it. It was just that the exposure of the equipment to being carried in the whole process was so high that 1 in 10 devices were being dropped. And until they had to change the process, that couldn't happen. And the same, it's kind of interesting because when I studied the bike messengers, people thought, they're really dangerous and stuff. And their actual injury rates were better than most bicyclists. It was just that they were biking every day. And over time, that became quite high. So but anyway, getting back, I digress, but it's about the idea of the humans, that humans have a certain behavior and we aren't always perfect. And you look at highway designs, you look at car designs, it's all part of that. And then the other thing that's important about this definition is that it sets 2 goals. And I remember Patrick Newman taught me this a long time ago when he had with production ergonomics, is that it's not just human well-being, it's also system performance. And understanding that that's the goal of modern ergonomics, is both human well-being and system performance. And I remember him giving a talk about 20 years ago talking about this, sort of a 2x2 and saying, well, if you only do this, it's not good ergonomics, or if you just do that, it's not good ergonomics. You have to do both at the same time. So it really talks about those those different ideas of sort of systems, talks about design, how design impacts that, and looks at the two outcomes, both human and system performance. The other thing the modern definition talked about, and I always do this, the triangle of ergonomics, is thinking about the fact that it's not just the physical, it's the cognitive and it's the organizational. And understanding that all three of those are the important domains of ergonomics, and thinking that a systems approach really, it needs to tackle all three of those at the same time. And we need to change the physical. So, like I said, it's a necessary condition to change the physical conditions, but if you don't change the organizational ones, understanding how people will behave in sort of a cognitive way, the impact of that isn't going to be that great. And I'll talk about this in a safe patient handling approach pretty soon. But again, I also put inside the circle of this triangle that sort of continuous improvement model of always trying to look at optimizing human well-being and system performance. So this is where I begin. I think as all ergonomists thinking about the prevention of work-related disorders, we have to think about this whole sort of holistic view of modern-day ergonomics, and it's not just about how people lift or my posture stinks. It's like thinking about how does the whole workstation support you, or how does the whole production line minimize your the opportunities for lifting. As Jack said, I'm part of the Total Worker Health Center at Harvard. This was a new initiative started about in the around 2005. NIOSH put out an RFA for new centers. At the time they called it I think it was Work-Life Initiative. I can't remember the exact name of it. In 2011 they branded the name Total Worker Health. And the idea with Total Worker Health was to go on, sort of take a systems approach and really start thinking about not just protecting workers' health, but promoting their health. There had been this huge initiative around wellness in the United States and in workplaces to improve the wellness of our workers, but those were primarily targeting sort of sedentary office workers, and not really looking at the wide breadth of the different types of workers out there. And often the people who are already healthy started taking advantage of those. So those are like all the initiatives that we have around, gym reimbursements and weight loss competitions among groups, and the different initiatives that we're just looking at trying to improve the wellness of the worker without taking into consideration the work environment. And the idea that Total Worker Health brought to that movement of wellness was this idea we need to think about the work environment. We can't just say no, stop smoking, or eat better, or do more exercise without understanding the role work has in this whole process. And I'll talk more about that in our systems model, that when we start thinking about health and safety behaviors, what are the factors that lead to those? Laura Panett, so the Harvard Center is one of now 10 centers across the country that NIOSH funds. In the early days, each of the programs of the early programs had ergonomics as part of the program, because I think ergonomics and total worker health overlap so much in their approach of that sort of systems approach and overview of the whole workplace. And as Laura Panett once said, which I always love this quote because it gets people thinking, if you look at the risk factors, work-related risk factors for someone smoking, that would be smoking or using tobacco, and then looked at the risk factors for low back pain, they were the same. High physically demanding jobs, stressed out, those types of things. And so they, if you looked at, so all of a sudden people started seeing these common pathways in the workplace, not only with musculoskeletal disorders, but also, but with behaviors around health and well-being. And so this whole idea of total worker health, and this is their definition that NIOSH puts on here, which is looking at the policies, programs, and practices that integrate protection and of work-related safety and health hazards with the promotion of injury, illness prevention, and efforts to advance worker well-being. A lot of words, again, like the other one, and what's interesting, if you talk to those 10 different centers, we all have our own different definitions of total worker health. I'm going to talk a lot about the Harvard model, which really, really emphasizes the conditions of work in terms of that. I'm going to say this, and I'll probably say it again. One of the things I like to think about, and why I think all the ergonomics was part of this, is musculoskeletal disorders is often what I think of as a canary in the mine in terms of what's going on in a workplace in terms of its organizational factors. Okay, I had a mental note to say that. I don't have a slide to say it. I'll come back to it a little bit later on. But that's what total worker health does, is really starts looking at organizational interventions to look at worker safety, health, and well-being. I bring up this quote. This is a paper that David Michaels is now a professor at George Washington University in Washington, D.C. He was the longest Assistant Secretary of Labor that was the director of the United States Occupational Safety and Health Administration in its history since 1970 when it was created. He served under the Obama administration. He's a great thought leader around worker safety. I'll stop with that term because he's really focused just on that. But he's written a lot in HBR. He just the Harvard Business Review, and he just has a new one out. But this was what year was this? 2018 that he wrote this, and he phrased it as ways of improving operations without sacrificing worker safety. And he's actually making the argument that if you actually have a good health and safety program, you're going to actually enhance worker operations of your organization. And he says that's because you have to look at, what is the management commitment to the operations, and that's the same, so what he's doing is making the argument that good safety and health is good management systems. And I've heard him say that time and time again. And when working with small businesses, especially in the construction industry, I've come to realize that when we are going and providing these interventions for these companies, what we're doing is helping them actually develop management programs for their companies. A lot of these small management companies don't have a specific management company practice or even manual, much less a safety and health program. As Jack said, what was that? Only 1 in 5 had programs, right? Yeah, so very similar to this. But the one thing that and he talks a lot here about top, management commitment, which we all know is important. He also talked about using the right incentives, and he actually challenged the idea of safety culture and said, the idea of safety culture is a misnomer because it's not that companies, when we say safety culture, it sort of indicates that companies actually have multiple cultures. And he says, really, a culture has one culture. A company only has one culture, and that's the argument he makes. The question is, does it include safety and health and well-being of its workers as part of its culture? So he sort of flips that idea of safety culture on top of its head and sort of says that, which I think is a key aspect when we look at organizations in terms of that. He also says, we often blame workers, and we always have to be worried about how we talk about injuries and the like. Sometimes we often look at the outcome and say, yes, our injuries reduced, but we have to be careful of not incentivizing people not to report, because every reported injury is an opportunity for us to learn about the organization and what's happening in that organization. If we don't have that report, we don't have that data, and that data doesn't help us drive change in the organization. So we have to be careful with how we celebrate those achievements, realizing that's our goal, but at the same time, we do want people to report because that gives us information so that we can get to that point and stuff. And he actually talks about this idea of focusing on leading indicators as opposed to other things. And he, again, talks about a management system. And then, since he was from OSHA, he said, our regulators can help you. And you can think about them as cheap consultants, but that was something else. So I wanted to sort of present so I presented the idea of ergonomics as a definition, total worker health, and then sort of safety management systems as a way of creating management systems for any sort of company as part of it. So now I'm going to talk to our systems framework. So I love this picture, but a lot of people find it overwhelming. So I'm going to break it down, but I do want to say that this is our model that we have at the Center for Harvard that looks at sort of the systems approach of a workplace. And this model is a culmination of the 15 years. We published this in this form in 2020, I think. It's on the slide. Yeah, 2021. We right when we were up for our renewal, we wrote this paper again and updated our model. And basically, what we did in this updated one, it was include sort of the orange and the blue, the layers of the onion. But I wanted to show it to you all right now, just to demonstrate that we're all working within a system. Some of it is in our control, some of it is not in our control, but it is what we're working on. At the heart of this model is the conditions of work. And that's as total worker health, if we're trying to get people to stop smoking, if we don't look at changing the conditions of work, we're not going to have the impact. And so the idea here is that, what are the conditions of work? And look at the factors: physical, organizational, psychosocial. Those are the three factors that that the Institute of Medicine and the National Research Council sort of categorized all the risk factors for MSDs back in, everything's around 2000 in my head. Must be stuck, but around 2000 when in the United States they came out with the Institute of Medicine and the National Research Council came up with a survey of all the evidence supporting that work-related musculoskeletal disorders are a real thing and we can do things to do it. And this was about the time that the Ergonomic standard from OSHA came out and was crushed by Congress a few years later. But anyway, this is at the heart of this, oops, oh yeah, tittle, sorry. But that impacts safety and health and well-being of the worker, right? And in here we have injuries and illnesses, okay? But we also have, and we have well-being and mental health. So the fact that mental health is a fact, can be a result of the working conditions. Also, health and safety behaviors, and also family and community are important parts of this. Whoops, oh yeah, I carried over the animation. So I really want to talk about this idea of health and safety behaviors, because I think this is where, total worker health and ergonomics, because we are talking about, I was talking to Erin right before this, that when we think about construction, we have a huge human system where we have all these autonomous workers out there doing amazing stuff, creating, but they're also changing, they're practicing and behaving in certain ways depending on the culture and the work environment that's supported there. But what I want to talk about is this idea of safety climate, another concept that people talk about. And I quote Dov Zohar, who just passed away this past year, who talks about this idea of safety climate is on the functional construct of organizational climate. So getting back to the organizational climate, where workers understand what is being rewarded and what is penalized. Okay, as a tenure track faculty, I would look around and say, okay, that person got tenure, that person didn't. What did they do differently compared to that person? We all have this mental model when we're in a workplace of understanding what gets rewarded and what doesn't. And as a result, we adjust our behaviors. How many people grew up in a big family? I was the next to youngest out of four. I watched what my older brothers and sisters did and said, don't do what they did. And then I got, also I think my parents got softer too, but I had a much different experience than my older brothers and sisters. But that's the concept of safety climate, right? Is this idea that you're getting all this messaging, and often within a complex and ambivalent organization, okay? And that these folks are operating in, getting multiple things. They're part of a construction site has so many different subcontractors on it. A hospital has different units and different factors as part of it and stuff. And what I like is that the climate perceptions require detection from multiple cues in the presence of competing demands and inconsistent policies. It's like, I remember I was house sitting a dog once, and I had it off leash, and I was walking somewhere, and the dog chased a cat into a garage, and the owners of the cat were right there, and I was like all upset. And I ran after the dog, and I said, Margot, why did you do that? And the owner looks at me and says, because he's a dog. But it's the same thing here, why are people, if we can understand what is going on with the workers, and this was really a basis of a whole partnership that we had with Skanska was, they were trying to figure out, we've plateaued in our safety and health metrics, but we're not where we want to be. How can we get to the next level? And we sold them on this concept. You have to understand what's going on in the workers' heads when they're making decisions and doing this stuff. And that's why, and this really promotes the idea of participatory or organizational participatory approaches, because if you can understand what they're dealing with on a daily basis, you can then change all the upstream things as part of that to help them make better decisions. Okay, so the other thing is that all this is linked to enterprise outcomes as part of our model. Well, what enterprise outcomes are we talking about? So these are what we listed. We didn't list them in our 2019, but we listed them in our 2016 model. Productivity and quality, we've heard that over and over again. And turnover and absences, job satisfaction, and healthcare costs. That's really important. That's in the safety world. We've also saw it in, I didn't realize there was all this. Okay, there we go. That when we actually move towards a whole culture of health and well-being, and this is from my colleague who comes from the wellness side of the equation, not the occupational safety and ergo side, but really looking at how wellness has changed away from wellness to actually start thinking about cultures of health and well-being. And when you change that whole culture, you're changing the whole organization, the policies, programs, and practices that really look at this. And this is the benefits that he lists and that folks have described when they really embrace this from case studies, from reduced healthcare costs, lower worker comp, best user experiences, reduced turnover, absenteeism, all these things, sustainability and engagement of workers. This is a simple example of healthcare costs associated with a social condition of work, bullying, which happens in healthcare and construction and lots of industries. Where you look at, so this is from a study where, this study is amazing because we have an integrated database for all this healthcare system where we have workers' comp, payroll, occupational injury reporting. It's a self-insured organization and they have all the data, and we've been working with them over the last 12, 13 years of creating this integrated database where we can look at all these type of associations, and then we've been doing worker surveys where we can link everything to the worker surveys to that administrative database. And this is an example where we could look at, this is mental health care costs and bullying. And this is from data from 2012. It was published in 2018, where we looked at the number and types of bullying experiences people had. Were they ignored or excluded? Were they humiliated or ridiculed? Or did people withhold information? And you can see the mental health costs just skyrocket when there's multiple types of this type of thing happening and experienced by workers. But this demonstrates sort of a healthcare cost of which increases premiums, which is a direct cost to the employer and the like. NIOSH actually lists a whole bunch of different aspects of the value added by doing this approach, improved effectiveness of worksite strategies, improved worker health. It improves outcomes and increased participation and enhances a culture of trust. And this is something that is really key when we do participatory approaches. And it's often something that we're still trying to figure out how can we do this better in our center of how can we create a culture of trust. As third-party people, when we go into worksite, people trust us. But when it's self-contained, how do people trust the management? And you have to build that often by demonstrating change over time and listening to people. Manage costs, generate revenue, become a stronger organization, improve job satisfaction, and also improve market performance, which I'll talk about in a second. So that's the enterprise outcome. I talked about, well, how can we intervene upon this? And that's what the Total Worker Health talks about, and that is the policies, programs, and practices that impact the conditions of work and that impact all this other things. Notice I've left the worker out on this one so far. But the other thing that we know is that context matters, and that the type of employment and labor patterns and social and health disparities and non-standard, everybody's talking about the gig economy these days. By the way, anybody who's a musician knows that gig economy's been around for a long time. But it's more the online platforms that are allowing for it to expand at rapid places. And also, I forget who I was talking to about Vietnam and different parts of the globe where like the family businesses in Vietnam and Southeast Asia are a whole different kind of model of organizational things. And now I remember where it was from. But anyway, those things make a difference. Coming up here to Canada, it's a whole different world up here. People are nice. Anyway, my point's made. Well, that's probably also the idea of social and political and economic environment as well, and global, we have this paper that we just, this is actually part of our model, but we also wrote a paper with a colleague of ours who was here at the Institute of Work and Health on a fellowship, Susan Peters, where we talk about sort of the globalization in technology, especially post-COVID, and how all this contextual stuff has really driven a lot of change on what's happening in the workplace today. Okay, so I'm halfway through and over halfway my time, so I guess I'm going a little slow. So now I'm going to talk about experiences in implementing our systems framework. And we've taken our research and we have a guideline. It's about 70 pages long, really exciting to read. And we've really turned it into a how-to guide for people to implement the total worker health. It's very similar to any ergonomics program or the like. These are the key characteristics. It's just a variation on any sort of safety management theme. Leadership commitment, participation by all levels of the organization. It can't just be the workers and it can't just be the management. It has to be sort of, I always like to draw this kind of picture, sort of thinking about all layers of the organization and how are they all involved. And in a way that they're trust. I remember one thing we learned with participatory approaches was we had to train the managers because all of a sudden the managers were getting feedback and the instinct was to be defensive. But if we gave them support and also changed the conversation to be about what's good on a work site, then they get, I remember one foreman said, oh my God, someone told me I was doing something right for a change. And how we don't do that at a level all the time. So anyway, so participation all levels, policies and programs and practices, that's from the model, that foster supportive working conditions. Comprehensive and collaborative strategies. We can't do it in our silos. We have to break down and talk to operations. We have to talk, in a hospital, we have to talk to laundry to make sure we get the slings for the lifts. We have to talk to the person who sends out all the equipment to a construction site to make sure there's picnic tables so people have a clean place to eat lunch. Just simple things like that, but we have to break down our barriers and think about how do we go horizontally with an organization to lead things forth. I think Meg Honan, I think several of you know who she is. She was the ergonomist at Genentech, really did that within Genentech. She was one person, and and as a result, she just didn't have the throughput to do it. So she really had to build team members across her whole organization and get them on board with her program. Adherence and data-driven change. And what data are you using? That data can be lots of different data. It doesn't have to be, the latest machine learning kind of thing of all your data. It can be as simple as talking to your workers. When I look at the best safety and health managers out there and walk a construction site with them, they know everyone and they have relationships, and that relationships gives them data, and that data they can then use to make change. And I think that's really key as well. We've done this program in multiple countries. Canada is not there. We've done it in construction, healthcare, manufacturing, food service, education, and transportation. And I'll talk about some of those as well. We've also partnered with other organizations. This is SAFE, which is Safety Accident Insurance Fund of Oregon. And we've been teaming with them, and they've just released this QR code works, so take a picture, and it will take you to their website where they've taken our implementation guide and broken it down into what they call 5 easy steps, okay? Identify what's going on, engage folks, and then design, create action, and review, right? Classic continuous improvement type of model, which is part of any sort of program. But they've broken it down in here for the total worker health. And really what they're doing here is implementing sort of an organizational participatory approach where they're trying to create change in the organization by listening to workers. It's based heavily on our work in construction of where we had to, take that 70 pages down and simplify it as well. Okay, so here's an example of a hospital mobilization, safe patient mobilization program. The program was actually looking to improve patient outcomes. And one of the patient outcomes they wanted, and the way to do that was to mobilize patients early and frequently after being treated. It's a classic way of reducing healthcare costs, getting, all sort of qualitative outcomes of a treatment plan are improved when people are up and moving faster and the like. Not all, but most of them and stuff. So they wanted to do this program, but they realized they were going to be putting workers at risk. And so they needed to figure out how do they create this safe patient handling program effectively to get the outcomes, their enterprise outcomes, but at the same time not sacrificing the health and safety of their workers. And so they did this whole program, and I'll talk about it in a second, and they came in and we were collecting data with all those different systems from surveys and administrative data to do a program evaluation. In fact, we worked with them so that our data collection would be a nice pre-post measurement of there. And they had 2 hospitals, and we had one hospital where the program was run and another hospital where it wasn't run. And so the program was hospital-wide. Again, it had the key characteristics: leadership commitment, which included, these are some examples of how they demonstrated it: internal marketing campaign, commitment communicated through emails and different things. They had a comprehensive and collaborative approach where they engaged multiple departments. They got out of their silo. The safety people got out of their silo. They started looking at, they created a management committee, a coordinating committee, and these all went across different infrastructure. And it was actually led by the quality assurance folks, the patient quality health assurance folks, with safety being part at the table there. They addressed lots of conditions of work, from physical environments, and including the laundry maintenance program. So not only did they have to make sure everybody knew, that the laundry and the slings were getting part of the system, and that there was a whole inventory management system as part of that, but there was also a maintenance program. So if something didn't work, it could be fixed quickly, because when things break down, people start, they stop using it and like. Thinking about work organization, one of the things they did was they integrated the use of safety equipment as part of the patient plan, and it was put into the EMR, and all this idea of like, how are you going to use the lift, when are you going to use it, and for what actions are you going to use it, and that was prescribed, and so they actually put it into the systems and the like, and a lot of one-on-one, and then also doing a lot of psychosocial, making sure there was support from the managers, and there was also a mentoring program. They saw we had a use scale. I'm not sure what it was actually measuring, but we saw a change in 8% of that. We actually saw lifting injuries decrease by 27%, which is great, and and again, that would reduce cost and workers' comp cost and the like. So a great example of a systems approach that incorporated all these different components of a total worker health. And the one thing, they didn't let us publish because it was a different group, because we only came in to look at the workers, but they did see, and so it's been unpublished data that we have, that patient outcomes also improved, mainly the reduction of bed sores improved in this group. This is another example of so that's a nice program evaluation, because it was a huge hospital, I don't know how many workers, 3,000 workers were part of that study and stuff. This is a nice case study we were working with our partners in Minnesota, another place with nice people. And Minnesota we've linked up with Nico Pronk, who's head of the Health Partners, which is a large HMO group in the Minnesota Twin City area and Minnesota, where they worked with manufacturing companies in their area, and they worked with this one they went in and did a case study with this one company that was applying all these principles to their workplace and around worker safety and health. And what they saw was, again, that the integrated approach brings together all these different folks, creates a climate of well-being and continuous improvement that results in a sustainable health, well-being, and growth for the company. So in here, the CEO of this company directly related the outcome of the growth of their company to this approach of using health and safety as part of that. In our own studies, so on the left, I'll talk about the study on the right, which is also from Nico Pronk, where they actually just went into companies and did health assessments. And they just did the assessments themselves, and where they went through and they actually, but they used sort of a team approach. They had what they call, I forget what it was, the indicators of corporate, I'm not getting the name right exactly, and I don't have it in front of me. But anyway, they used an organizational evaluation tool, and they just didn't have the safety manager did it. They brought together a whole team of people from across the organization to fill it out. And they did these assessments, and the result of the assessments then led to action. That wasn't part of the study, but the company said, oh, we want to improve this. And what they told us time and time again was that assessment taught them something about their organization they didn't know. And it wasn't related to health and safety, it was more related to organizational efficiencies. We implemented something on the left is part of my study team on the right and some construction workers on the right, where we would just go out to parking lots. We'd bring our poster that actually had an ecological model of the work site, and we'd say, okay, tell us what's stressing you out at work. I mean, what are you worried about in your health and safety at work? And it was usually mental health and MSDs. Those were the two things that always came up, almost hand in hand. And then we said, okay, well, what are you proud of? What feels good? But then what's the company doing to support you in this area? Again, get the good feedback. And then say, what can they do to improve? And we even said, what can they do to improve? Not said what was bad, but what can be improved? And using that positive language really changed the dialogue. It changed it from being a complaint session to a constructive opportunity. And language matters, I think, all the time when we do this participatory approach. And then we went in and said, okay, well, what are some bigger things? And we determined those worker experiences, and then we reported that back to the management, and the management said, oh, we had no clue that this was going on. And so I call it determining what are the worker experiences on the front line and using that to drive change. That's part of the key part of that. Again, all our companies that we were successfully able to run this, some companies were like, what are you doing? Go away. But the companies that were willing to work with us and were able to learn operational things about their company they didn't realize were happening. And they felt that they became more efficient as a result of this. The title of this slide is Work Stress. Worker stress leads to, usually that's the canary, right? The worker stress is the canary saying something's operationally not efficient. And how can we as managers think about using that data to create more efficient organizations? And worker stress is directly, remember, the common pathway, right, to low back pain and shoulder pain and all the other things. So that's why I say that MSDs is often a canary in the mind, telling us that there's something in the organization that we can fix, and how can we do it better. One last sort of case studies, I threw this slide in just this morning, so it's not online. But we were running these programs on two companies, one in Chile with this bus company, where we were running bus company, and we were working with the drivers who had to drive workers from this town up to about 3,000 meters in the copper mines above in the Andes. And we did all the intervention work and got the intervention running and the program going in March of 2019. November of 2019, the social unrest happened in Chile, where the subway fares went up and there was the mass riots. And actually, these bus drivers were kind of like the Google bus drivers in San Francisco, where they were getting egged and because they represented sort of the money, that could continue. But then they had COVID the following March. It took us forever to get our follow-up study done, because we were supposed to go down in November and then supposed to go down in March of 2020. We finally were able to do it remotely and electronically. But all the feedback we got was that not only did did the programs help with the idea of creating, and then on the left-hand side, we were on a construction site in Boston running that program where we go out and do the ecological model, and had done it, and they were actually implementing the changes that they had identified from the workers' experience when the pandemic locked down, and this was an essential site, so it stayed open. And in both cases, the fundamental approaches that we had taught them and were using, they adapted and were able to be more agile during this very high-stress time for everyone. You know, that was just the whole organization. So this approach also helps organizations not only being more efficient, but also more agile to the things that come down the road. So lastly, is this the right slide? I'm just going to skip over this slide real quick. This is just a website that you can go to, and it talks more about this idea of building a culture of health improves business success. So the next few studies, again, remember I said, okay, so where's the data, right? And so I've sort of showed you some case studies. Well, now let's look at some companies that get awarded for get award for their efforts around occupational safety and health from organizations that are supportive of that. So I've got a couple examples, and this is old data now from 2013. And I know Ray Fabius, who wrote this paper that I'm talking about, has looked at this since. But basically, the idea of a culture of health improves brand and the return of investment. So what I show you here on the left is the Standard & Poor's 500, S&P 500, and on the right is the American College of Occupational and Environmental Medicine Corporate Health Achievement Awards, okay? And what Ray did, and so those are some of the lists of the different companies, and this is outdated, it needs to be updated, but what he sees is if you look at, if you're an investment banker and create a mutual fund based on that, you actually outdo the S&P 500. And so this is sort of so this gets back to what the stockholders want to know, right? How are you performing? And if you invest in a culture of health, you can see performance in the stock market. HERO is the Health Enhancement Research Organization. I'm on their, for disclosure, I'm on their their advisory board. And HERO is they have member organizations, but they have what they call their scorecard, which companies can use, and they looked at people who score, I think above, what was it? The top percent, I forget what the cutoff was, but they looked at their top level performers on the safety card, again, looking at the same sort of stock market performance compared to the S&P 500. Again, the companies outperform. And then the C. Everett Koop National Health Awards, again, showing that the corporations, over that year from 2001 to 2014, it includes the 2008 Great Recession, but you see the return on the C. Everett Koop National Health Awards was 325% versus 105% for the S&P 500. So that's what I have for you today, is the demonstration of the systems approach and sort of the different levels of case studies all the way up to sort of the corporate level. In terms of that, always starting with the fundamental definitions, always. And that's why I'll end with going back to the definition of ergonomics. Again, it's human well-being and system performance, and we need to do that together and think about that all the time. And this gives us, as Rick said, the tools to help convince upper management what we need to do is important. I want to thank my colleagues at the Center for Work and Health. It's a group of people. I'm here just representing them. I was the associate director for many years now. I'm a senior advisor and consultant. And Boston doesn't look like that quite yet. That's probably in a couple weeks. But anyway, thank you very much. So Jack says I have 5 to 10 minutes for questions. Yes, please.
Hi, I'm Emil Messick, Unifor. I just want to refer everybody, everyone's seen that picture where there's a hole in the ground and there's a worker in the middle and he's got a shovel and he's surrounded by the CEO and the safety director and the controller and the organizational manager. And it just goes to show that if you really want to integrate health and safety and come out with, you have to talk to the person that's in the hole. And I think that this integrated approach is something that the auto industry has really looked at in terms of integrating health and safety, ergonomics into every aspect of the job, down to the actual sheets that the workers do. So everything is integrated, and I think it shows that in such a potentially dangerous, injurious industry, that the numbers are so low. So I think that we're catching on, that we have to ask the workers what they need in order to be productive for everyone.
Absolutely, and I think some of the things, I listed the key characteristics that we had, and I said this mirrors a lot of safety health management systems, and I think we've been learning from all the different years that of the case studies and the experiences, and I think David Michaels had the I2P2, which is injury and illness protection and prevention. That's not quite right, but anyway, his I2P2 white paper was was based on those experiences that come from the industrial leaders in this area, like you say, have been integrating this. It's nothing new, but it's like, how can we spread the wealth around in terms of get more people thinking about this? Yeah.
Yeah, thank you. I really enjoyed your presentation. It's something I believe in very strongly. And also the comment that was made by the union, absolutely essential. I have to declare a conflict because, like Rick, I'm here on vacation, and I was told by my manager that I was not representing the organization that people might associate me with, so none of the comment I'm about to make reflect on the organization. One of the things that struck me, and I just need a little help in you putting it in perspective for me. We all sort of invest, and I like that. If you've got a really good safety approach, you're doing much better on the S&P and all of that. So that's a really resounding message. But there was one company that was up there that was a little troubling to me. And I just wonder if you could help put that in some context, or if you know something, did it change their, did the terrible events that happened to that company, did it change the way they look at safety? I just like to get a little more perspective if you have.
Yeah, so I didn't do the words and all that, and I'm just reporting the paper, but okay, that's a grad student cop-out of an answer. But what I do know and what I can speak to is the fact that often, one of the best ways to improve safety culture, what is the most common reason a company will start changing their safety culture? What is that?
Well, be an accident.
An accident. Something happens, right? And unfortunately, we often, and we saw this with Exxon, right? After the Valdez accident, there was a whole change in the organizational culture and the like. Sometimes it takes those.
I think it would.
And we've done this time and time again in occupational
I
safety.
would qualify my answer a bit, because it's not just an accident, because we know accidents happen all the time.
Right.
It's an accident that affects the president. I think I would answer it that way.
And brand and the like. So I think you're absolutely right with that. Other questions? Yes, someone's going. Yeah, go ahead.
Hi, Don Patton with WSPS, a health and safety system partner here in Ontario. Just curious in any of your conversations with companies and employees of whether or not the stuff that went well and how that may have informed some of the prevention things that you put in place.
Well, that's exactly why we did it, was that, it's classic leadership models, right? Build on your strengths. So if you don't evaluate what you're doing well in safety and health, how can you build on that? And that was one of the reasons, and that's how we proposed it to our partners, was this idea that, what's going well in the company can be what we can learn from and help us understand what's going on. And we actually started getting the workers to think about this. Okay, well, if this, they do this over here, why can't we do it over here on this situation? And there might be barriers to that, but that was the conversations we were trying to get going. Was, again, we wanted to change the participatory approach from where we had seen people saying, as one manager said, it's their it's their letter to Santa Claus and what they want for Christmas, and to changing it to be something that was a little bit more solutions-based to help everyone start thinking about the solutions. And that was why we did that, and we had that conversation with companies, so I think you're right on with that. Great.
No, you're not getting it yet. Oh. So there's a lot of practitioners in the room. So we're often called in a reactive approach. There's a problem with a job, you're going in to look at a job. What advice do you have to them? How do you push this up to a corporate culture level and get away from just dealing with that one job that was a problem?
I wouldn't be a dean if I had the answer to that question. I'd probably be a good consultant. It's, in our experiences, often you have to find an ally who helps you move the argument to the upper place. I think that's where we've been successful, is we found somebody who has a shared value. And so I think that's the best piece of advice, because I know I've made the mistake of going in and saying, well, you're not doing it right. I didn't get that job. And so I would say, what we've been successful in working with companies, I think, is what a practitioner is like, find where your allies are, get that shared value, and work with them to move this idea forward. And part of that's listening and sort of asking questions. And I think that's partly what is necessary, is to trying to understand where there's the shared value and the shared opportunity that you have there to move it forward. And I think that's how you're going to you're going to be reactive. You're always going to be reactive to certain situations, but try to understand and asking questions, well, why did this happen? Why did this happen? And then try to understand who are the different stakeholders and start talking to them about their shared values of what to do around that would be my advice. And I'm open to any criticism or other suggestions you may have on that. But that's been our success, is making sure you have a shared ally when we get on construction sites. That's often when we get success, is when we have that. And other times it's just companies wanting to do something because OSHA cited them.